Our poster presentation today comes from the University of Florida Pediatric Pulmonary Center, which I will refer to as UFPPC. Ellen Bowser, co-director of the UFPPC and faculty nutritionist, will be representing the team today. Ellen is a registered dietitian and RN who has served as lead analyst and consultant for the Academy of Nutrition and Dietetics Evidence Analysis Project. She was awarded Outstanding Member of the Year by the Pediatric Nutrition Practice Group of the Academy of Nutrition and Dietetics and is a Fellow of the Academy of Nutrition and Dietetics. She was awarded Outstanding Dietitian of the Year in 2019 by the Florida Academy of Nutrition and Dietetics. Mary Abney Wagner, MD, is the director of the UFPPC and the Pediatric Sleep Program at UF Health Sleep Disorder Center. She is board certified in sleep medicine, pediatric pulmonary, and pediatrics. Dr. Wagner evaluates and treats children with a wide range of pulmonary and sleep disorders. She has written numerous publications on the care of children with pulmonary and sleep disorders. Dawn Baker is a nurse practitioner and nursing faculty with the UFPPC. Her interests include pediatric and sleep medicine. Her research focuses on children and youth with special health care needs, as well as the pediatric pulmonary medicine interdisciplinary training. She works closely with the faculty from the Severe Asthma Program. The Florida Asthma Coalition has previously recognized Dawn Baker as an asthma champion. Tatiana Pulcini is a licensed clinical social worker for UF Health Pediatric Specialties and the UFPPC faculty social worker. She has supported children with special healthcare needs since 2014. Her clinical interests include family empowerment, patient advocacy, and mental health. Angela Miney is the UFPPC family partner. She works with leadership at UF Health to incorporate the patient voice into all systems. As a parent of a special needs child myself, I appreciate your work. It's very important. Working with Florida State Title V office, she coordinates the Florida Family Leader Network. In 2021, Angela received the Merle McPherson Family Leadership Award. And finally, Elizabeth Pate is trained as an Echo Hub partner who provides groups of community providers with the ability to connect in real-time collaborative sessions. She has a background in both nursing and association management. And now it is my great pleasure to turn this over to Ellen Bowser.
Thank you so much, Dr. Weiss, and thank you for allowing me to talk about our Project Echo. I'm going to talk about a collaboration that the University of Florida Pediatric Pulmonary Center did with the Swanee River Area Health Education Center and the Florida Rural Health Association. So I think we all know, and have certainly heard today from Wanda, that we're continuing to see issues for kids with asthma, particularly children who are in the rural areas. It was interesting to hear the data that Wanda showed earlier that Black and Hispanic youth have increased incidence of current and lifetime asthma compared to non-Hispanic whites. And I think we would see those children, particularly in the rural areas. And we know that access to evidence-based guidelines is really important in the treatment of pediatric asthma, and it can be difficult for providers in those communities to get that kind of information. So what we decided to do at UF, at the PPC, was to develop, to collaborate on a Project ECHO. And ECHO stands for Extension for Community Healthcare Outcomes. ECHO as a model was developed by the University of New Mexico School of Medicine in 2003. And really ECHO is both education and mentoring from experts to community or remote providers. The ECHO model is a hub and spoke model where the hub is the expert who generally at a tertiary care facility, but not always. And the spokes are the rural or community providers or agencies who are gathering that information from the providers. So again, if you think about the way that we had it set up at our ECHO, was the Florida Rural Health Association was really the ECHO hub. And we were able to come in and give this information to the community and rural providers. It is done through distance technology. Our ECHO was done through Zoom. And we partnered again with the Florida Rural Health Association to provide 6 sessions on pediatric asthma in the spring of 2022. This was actually our second our second ECHO project. The first series we did in 2021, and that was on pediatric sleep and sleep health. But we selected asthma as a topic for 2022. So we, again, as I mentioned, we had 6 ECHO sessions. They were each 30 minutes, and we selected a noon time for ECHO because we thought that that would be a more convenient time for the providers and community agency staff to be able to tune into the ECHO. We had them on Wednesdays, just happened to be a convenient day. So again, we had 6 sessions, and we wanted a an interdisciplinary approach. So you can see our first 2 topics were a little bit more focused on the science behind treatments for asthma. We had a pharmacist, Leslie Hendelis, who gave those 2 sessions. Our next session was on the allergen immunotherapy, and that was by Elizabeth Lefebvre, a nurse practitioner. Our next topic was on technique and how to use devices, and was done by Alicia Hardy, registered nurse and certified asthma educator. And she did a great job at really showing the best way to use particularly inhalers. Tatiana Pulcini, our social worker, gave the next session that looked at support resources that improve access and adherence. She talked a lot about insurance and Medicaid and the things that are available for families related to asthma. And then our very last session was by David Fideli, a clinical psychologist, and he really looked at what can we do to help empower our families to be able to take their medications. So what did we find? We ended up with 155 professionals and students who attended our 6 sessions, and 75% of them were employed in medically underserved or rural communities. As you can see, our goal was to have a multi or interdisciplinary audience, and we had our professionals included registered nurses, nurse practitioners, pediatricians. We had emergency responders, paramedics. We had family partners, and we also had emerging health professionals, which were our students. So our goal was really to hit those rural communities, again, the rural providers. And so this map on the right is actually a map of Florida, and the blue counties are those which are considered to be urban, and the yellowish gold are rural communities. And every star that you see indicated that we had someone from one of those counties at our on our ECHO sessions. So we were really happy to see that we had at least 9 rural counties participate in our ECHO. And here on the left, these are just some of the agencies who participated. We had the Calhoun County EMS up in the Panhandle. We had pediatrics in Brevard and Brevard County. So we were really pleased that we were able to get the reach that we were hoping for. So what did our participants say? Our participants agreed with the following statements. The sessions fulfilled the goals and objectives. The program offered them skills or knowledge that would help them improve their patient care, that provided relevant knowledge for their practice. And the idea one of the goals was to have the ECHO at, again, having that location and the time that would be convenient for the providers so that they wouldn't have to leave their practice or time away from their job. We also asked our participants, what new knowledge, information, or skills did they obtain from this activity? And so these are the comments that our participants wrote in: adherence, resources for families, learning about sublingual allergen immunotherapy, treatment for asthma, how to treat exacerbations, and then the expanded Medicaid benefits for children. So in conclusion, we felt a Project ECHO program provided teleeducation and telementoring to a multidisciplinary group of healthcare providers, both rural and urban settings. We felt that education using Project ECHO was an effective way of increasing the access to experts in the care of children with pediatric asthma. And we would like to suggest we should continue to use Project ECHO to to provide additional education to topics and providers in underserved areas. So we at UF are planning to do ECHO 2023. Generally, we started our sessions after the first of the year, so they would go January through March or April. Our sessions for asthma, we had two a month. And so it was generally every other week, although we had to move our schedule around because of some of our team. But we are going to develop a needs assessment, and we would really encourage people who are at the summit, or if you can share it with others, to let us know what you would like. This is my email address, and I know Dr. Weiss would know how to get a hold of me, but we would greatly appreciate your feedback, and I'm happy to answer any questions you might have.
All right, folks, that was a terrific presentation. Thank you so much to our Project ECHO team, very dynamic. Definitely encourage folks, if you would like to stick around, I'll hang around. If you do want to ask questions and have them gotten into the recording, you can ask questions in the chat as well, or follow up by email. Please do feel free to start your lunch break. Remember that we've got Expo Hall is open all day. That's accessible in the Expo Hall button on your event page, and then you can navigate to the individual speaker areas to visit their website, contact them, and then we're also going to have breakout rooms available from 1 to 2 p.m. Also want to mention, we did get the last minute approval for CHES credit for Dr. Garcia's presentation for later today. So that's now eligible for both pharmacy CEUs and certified health education specialist credit if you fill out your PDF paperwork. Dr. Weiss is reminding everybody that not only is the poster available on your event page and the agenda where you can download the PDF of it, we're also going to have it up on our Florida Asthma Coalition website. So I will stick around. I will moderate. If we've got any questions coming in, I'll take a look at my event chat if folks want to ask questions of our poster team. Our next presentation will be at 11:55 Eastern, overview of the State Health Improvement Plan.
Thank you. I'll be here as well, and I just wanted to congratulate the entire team. Thank you so much, Ellen.
Thank you for asking us to speak. And I know several members of my team are on. I can't see them, but I know we've got asthma clinic happening today and a lot of other things, but I know as many of the ECHO partners as possible were with us.
Super. So I don't see any questions yet in my event chat. Although Katie, was your question about Project ECHO? I see a comment from Katie. This sounds great. Is this something that may be rolled out soon? I would love to get our organization to attend something like this one when available. Based on that, that might have been a Project ECHO question, judging from the timestamp.
Yeah, so again, as I mentioned, we're in the process of developing the needs assessment to send it out. To really, what we want to do is make sure that we're able to we're going to ask specific questions to see if we can address the topics that are identified. So probably after the first of the year is generally what we've done. So they would probably start in January, but in the past, we usually have the schedule completed by October or November. So that's the way that it's worked out the past couple of years. I'm guessing we would do the same thing.
Super. All right, other questions? We do have a few more minutes with our poster presenters, and we really appreciate you coming and sharing with us today. This was great to be able to
I did want to say too, if you're interested to go to Project ECHO website, there's a lot of information. You can learn a lot more. I mean, I didn't spend much time talking about ECHO, but there are videos you can see. There are ECHO projects that go on around the world. And so it's an interesting and unique concept. And I think it's really going, to reaching people who otherwise could not come in to conferences. Now with Zoom, it's a little bit easier, because we can have virtual discussions. But prior to, I think when COVID really hit, there weren't as many, distance educational sessions. So that's what's unique about ECHO.
Do you want to put that website in the chat, Ellen?
I will. I have to find it. I think it's projectecho.org, but I would need to, I can definitely get it to you.
I'll send it around. No rush.
Check back my event chat tab to see if we've got more questions. I'm seeing a lot of positive comments, just great information and appreciation for what you're doing and for coming and sharing with us today.
If anything does come up later on, if you could just maybe email it to me so we can address the questions, or if people want more information, I'm happy to get with them.
Sure, and if you're going to stick around, you can also continue dialoguing with people in the event chat.
Yeah, and you could send it to me too, and I'll make sure the whole poster committee knows that it was a very good and successful presentation. Thank you.